So right now we're just in the process of injecting Anne's cheeks, and we have prior injections in here. So the idea is, I doubt we're gonna need a ton of filler in the cheeks to just make things look, you know, kind of re-volumized, if you will. The whole time I do cheek filler, I'm kind of looking back and forth between the two cheeks just to make sure we're keeping things as even as possible. You know, no one is symmetrical in nature. So we have an idea that we can't create full symmetry, but if we can try to replicate some level of symmetry, that's usually all we need to just make not just the patient happy, but also myself happy. With cheeks, I don't like people to look too cheeky, if you will. I mean, that's not a very medical term, but I don't want too much in the back. I don't want too much in the front. I just want it kind of diffusely spread out. So that's really what we're working on right now, is just kind of getting a little bit of this filler spread out all the way. I think the biggest worry for people is that they're going to look like they have little balls in their cheeks. But if you do it right, you know, quote unquote right, hopefully you can avoid that by simply just making sure everything looks balanced within itself. Okay. So basically I took one syringe and I just kind of diffusely spread it through the cheeks. At this point, I'm happy with how her cheeks look, so we're going to transition down into the jawline, primarily the chin. All right, so we're transitioning down into the chin. So basically what I like to see is this line of her jaw be more linear. So that's what I'm going to try to work on. So we're just going to start kind of right in the forefront here. And I do my injections rather slow and meticulous. The beauty about filler is that you can place it, kind of massage it out how you want it. The only unfortunate side about filler, honestly, is that you can bruise more, especially down in the chin area. So now that I've created a kind of a more appropriate line, I just want to also balance it up here with a little more. Cool. So I'm just going to smooth the filler out. We've finished our 2 syringes. The reason I like to do this, I mean, honestly, you don't have to. It's just something I've done from the beginning, just to make sure that underneath my fingers things feel nice and smooth. I just personally think it helps decrease risk of nodularity, which is a risk of filler. You put it in, it can kind of ball up. So that's what I like to do, just make sure everything feels nice. So we're going to transition to Botox.
Okay.
I like to mark muscle movement. So face me, scowl at me. And honestly, you can do this treatment without marking. I've just done it forever. Scrunch your nose like a bunny. Smile. Raise your eyebrows. Yes, I would rather people continue to move their forehead and come back for more than have no movement and feel heavy.
Mm-hmm.
So I am doing the same unit amount that we did on you last time around. Smile. Relax. So we'll see what it does for you this time. You know, muscles are ever kind of shifting and changing.
Mm-hmm.
So sometimes what we did one time may not be appropriate for the next time.
Interesting.
So we'll just see what your muscles like. Okay. And I don't know if it's translating on camera, but oftentimes people will look like they have little bug bites
Mm-hmm.
with their Botox, and that absorbs within about 15 minutes or so after an injection. So usually by the time you get checked out, you walk to your car, and you see yourself in the mirror, they're already gone. So people usually don't know that this happens with that injection. Face up again. Relax. So again, with Botox, you just don't really know until it sets in
Mm-hmm.
if you'll need more, less. So we'll just see how this works. Again, I'm just kind of diffusely spreading the units.
Mm-hmm. Creates more subtlety.
That's right. And the reason I like to go higher on the forehead as well is sometimes it can actually lift your eyebrow. I mean, there's no, what am I trying to say, guarantee that it will lift, but there's a potential. All right, dear, that's it. So 4 reminders with Botox: keep your head up for 4 hours. Don't exercise for about, 12 to 24, give or take. Don't use a lot of firm touches on it either. So with like washing your face, doing different things like that for a good, 48 hours or so, I want you to use light touches. Same thing with your filler for about 3 days time. You want to try to use lighter touches and try to avoid sleeping on it for about 2 nights if you can. And then after that 2-week mark, you can come back for a little Botox touch-up and or to add more filler. we'll just clean you up and you're out of here.
So the preferred method for sleeping is on the back if you can?
Only for 2 nights.
Okay.
And again, I mean, if you wake up on the side of your face, I don't think you ruin it. That was just something that I've always been told. Just try to keep pressure off of it for about 2 nights. So I've had like people call me the next day. They're like, I slept on it. I'm like, you're fine.
And is it okay to take pain reliever now, or shall I wait?
Actually, that's a great question. So what I would really prefer, like what I do when I inject myself or I get injected, right when I get home, I just take a dose of Tylenol.
Okay.
That way I'm like ahead of the game because that filler has lidocaine. So the lidocaine works for about an hour or 2. But when that lidocaine wears off, you can expect to be a little tender, a little uncomfortable. Okay. My cheek filler usually gives me tension headaches. Jawline filler, I mean, it's more in your chin, so it's just going to be weird with talking and chewing for just a couple of days. But if you go ahead and take that Tylenol and kind of get ahead of the lidocaine wearing off and then try to keep up with Tylenol doses for the rest of the day, that's usually helpful.
Okay, good.
And again, for reminders, pineapple juice is great, arnica is great, different things like that is also good for just the overall healing process. It may not improve pain, but it can help improve the healing. All right, and then before you head out, I just want to kind of touch you up a bit, and we're done.